So in this presentation, I will be discussing The Defense of the Traditional Nurse by Lisa H. Newton. And before she gets into her argument, she defines a few terms. So a role is a norm-governed pattern of action that aligns with social expectations. An image of a role is a role as it is understood of both by the occupants of the role and those with whom the occupant interacts. In other words, how it actually is. An ideal of a role is what the role should be and what people want it to be. So in the first section, Barriers of Autonomy, Newton states that the public believes that nurses are ill-educated and are excluded from professional status. And due to this, they are prepared to be truly anonymous. However, Newton rejects this claim by saying, how can the lack of education justify the desire to be autonomous? And two, there is a discrepancy between private ideal and private image. The private ideal is that the nurse is an autonomous professional, and the private image is the actual performance is very subservient with bureaucratic control, tight schedules, very limited role. And therefore, nurses are really not autonomous professionals in the words of Newton. And three, there is a discrepancy between private ideal and public ideal. And the public ideal is public does not want nurse to be an autonomous professional. The present subservient status serves the need of physicians, and therefore nurses need to form alliances to defeat their traditional ideal. And what's in common with all of these aspects is that the nurse should be independent and autonomous and free from the image of submissive service. But according to Newton, this fails to account for the purpose of the traditional nurse and why it's so important. So one argument Newton implements that defends the traditional nurse is using the ideas of the hospital and medicine and how those fields often require strict policy procedure. So the argument that Newton lays down is that the hospital and medicine fields require strict adherence to policy, procedure, and expertise, and any input from outside autonomous agents, such as a nurse, would disrupt the system. A nurse fulfills this autonomous requirement, therefore the nurse disrupts the efficiency of the medical system. The counter argument to this is Newton could be conflating autonomous with disruption of procedure because just because a nurse is autonomous, that does not necessarily mean that would automatically indicate the disruption of procedure. You could be autonomous and contribute to the procedure very nicely. So that's just a counter argument. In the next section, Motherhood View of Nursing, Newton notes two specific needs of the patient, which is specialized care, in other words, a physician, and simple mother-like care, which is a nurse. And Newton essentially states that nurses should take on a mother-like role. The first argument is that the nurse role should involve a nurturing component that is mother-like, and this role permits the patient and nurse to be on the same level, because once they're on the same level, the nurse can't control the course of treatment in the patient. So in that way, the patient and the nurse are on the same sort of level in terms of lack of control. And when this occurs, the nurse's compatibility with authority is lost and subservience is the result. And therefore, because of this, the role of the nurse should be incompatible with authority and should serve a subservient role. A counter argument could be the nurse could act as both a mother and autonomous figure. And also, should nurses have little control over an environment, which is similar to a patient, because nurses could add a lot to the hospital system, and little control over the course of treatment could be detrimental. So that's a counter argument. For the next section, the provider of humanistic care, is that Newton essentially states that the bureaucracy nor medical profession can't handle human needs of the process, and healthcare is traditionally seen as mechanical. And so it is important for the healthcare system to have nurses in traditional roles to provide human-like qualities. The first premise is the traditional hospital system in its professional context lacks a human quality, and the only way to alleviate this bureaucratic approach is to have a person occupying a traditional non-autonomous role of comfort, and nurses are the only important figures that occupy that tradition. So therefore, nurses should adopt this traditional subservient role for alleviation. An objection could be, does the nurse really need to lack autonomy in order to serve a role to alleviate? Because nurses could be autonomous and self-functioning and not necessarily have to be traditional in order to provide a sort of comfort. And non-autonomous roles don't necessarily always have to be the case in order for nurses to do what they need to do. So that's the presentation. Thank you so much for listening.